Hey everyone, welcome to our Game Ready series. This is episode 11, Concussions, What You Need to Know. I'm Dr. Summer Ott. I'm a sports neuropsychologist and director of the concussion program at the Hermann Sports Medicine Institute in affiliation with UT Health in the Department of Orthopedic Surgery. And also with me this evening, I'm delighted to have Dr. Chris Shields.
Hi, I'm a physical therapist at the Hermann Sports Medicine Institute here in the Med Center, and I'm a physical therapist and I treat concussion, and I'm one of the coordinators in our concussion program, and Dr. Ott is our director of the program.
We're pleased to bring this episode to you tonight. We're kicking off, or we did last week, our Concussion Awareness Week, where we had several content opportunities and different aspects that we talked about with respect to concussion, long-term consequences. We had some patient stories. So we would also like to direct you to our social media outlets for UT Ortho, where we have those materials present. But this evening, we're going to talk to each other, really kind of have some dialogue here about concussions, ask each other a few questions. I'm sure there's some burning questions that you've had, whether you're an athlete, former athlete, you're a parent of an athlete. Certainly concussions can happen in non-sport related accidents as well. So we'll touch on some of those things. But first and foremost, why don't we just talk about first what a concussion is? There are a lot of misconceptions about concussions. One of which that I hear a lot is that you have to lose consciousness to have a concussion, and that's not really true, is it, Chris?
No, yeah, not at all.
So in terms of concussion itself, it's really a blow to the head or body that happens with significant force, and generally there's some mental status changes that can occur, like feeling disoriented, confused. You don't always have to have a loss of consciousness like we indicated. You may forget aspects of the game or maybe the event in which you were injured, and then sometimes the symptoms even happen delayed, or they may happen a few hours afterward, which leaves people to be puzzled if really they had a head trauma or not. So moving forward, what would you say is the difference between a concussion, and a lot of times we hear, the subconcussive blow? I mean, what's your understanding of the difference between those two things?
I mean, obviously, I think the concussion gives you more, immediate symptoms. So a lot of times there's more of the symptoms in those, what we would think is concussion symptoms of the headache, dizziness, and all the stuff you kind of just talked about. But in the subconcussive blows, you don't always have those immediate symptoms. And that the thought behind that, right, is that you probably have more gradual buildup. And if you have multiple of those, there could be kind of a long-term or persistent effect from that. But yeah.
So I really like that there's been some technology too, as of the past few years, that really kind of look at head impacts in athletes, and particularly in football and other contact sports where athletes may be leading with their head and not tackling appropriately, and so head impacts will give us some good information about educating our athletes how to do things more appropriately so that they can maybe minimize those head impacts. But how can you tell if someone has a concussion? It's not obviously always apparent. So, that's a question we get from parents all the time. And so, in particular, this time of year we get, well, is it dehydration? Is it allergies? Is it sinus? Is it COVID? Is it concussion? So some of the ways that I've been able to tell those things apart is with concussion type symptoms, they tend to get worse the more that you're physically active, or especially when you're in school and you're trying to do schoolwork or mental activity. So a lot of times with headaches, maybe due to other etiology, you won't always get that increase in headache, pain, or severity with the activity that you do. The symptoms tend to be persistent. They tend to continue on over days to maybe even weeks, where other conditions can maybe wax and wane. So one other question I have for you, Chris, is what are some risk factors to concussion? I mean, are there people that tend to take longer that you see in your clinic, or maybe they tend to get better more quickly?
Yeah, it can be. So a lot of times, if somebody has had numerous concussions before, so history of concussions is a common one. There's, and you can probably speak to this because you've done some good research with that, but it seems that females are more likely to have concussion, but does that maybe preclude them to having worse symptoms? It's possible. I don't know if you want to speak to that in some of your research, but definitely migraine and very bad symptoms right after the concussion, and sometimes different sports, the more aggressive sports can cause some more symptoms. But did I miss any in there?
Well, I think one of the other things that we see is kids that might have some learning issues, or maybe they had some pre-existing difficulties coping with stress, or maybe adjusting to new types of situations. They tend to have a little bit harder time coping with concussion. So I think it's up to folks like myself and you to recognize those barriers and help address it with the family and the athlete so that they can get better more quickly.
Yeah, absolutely. It can make those symptoms worse too, right? The anxiety and depression.
Right.
Maybe a lot worse with that. Good.
Do you want to pick my brain?
Yeah. So, what is one of the ways that we can diagnose the concussion? And sometimes it's hard to determine because there's a lot of symptoms. Sometimes when you have athletes and even other injuries like car accidents and whatnot, what's the way that we can help diagnose that concussion?
I think that's the burning question, especially on the sideline when it's like, oh gosh, can we let this athlete go back in and play? Was it really a concussion, or did they just kind of get shooken up for a little bit? That's a tough role to be in on the sideline. But I think it's really important to kind of follow the athlete, have a careful questioning session with them about, what are the symptoms you're experiencing, observe them. We don't always want to rely on self-report, right? So we both have been athletes before, and we probably would beg, borrow, and steal to play sports. So we know that you athletes aren't always forthright about your symptoms. So we certainly want to make sure that we do other objective testing. So in my role, we do a lot of cognitive testing. We see that the brain's functioning properly, they're doing well in school. And in your situation, what would be some of the functional tests you might do to help determine that? That diagnosis?
So we look, in PT we will look at the neck and see what is kind of going on with that. But concussion and whiplash are kind of very similar symptoms, and so a lot of times we'll screen out the neck and make sure that's not the reason. But in terms of the specific concussion symptoms, a lot of times we're looking at dizziness, and we kind of look into balance, and sometimes there's issues with the vision problems as well. So it's kind of what we'll screen out in PT, and we also will do the exercise kind of intolerance test. So like you were saying, exercise oftentimes make those symptoms worse. So we'll look at that and see if that's the case.
Yeah, that's really something too that I would want to bring up is that, when I first started doing this several years ago, the idea was this sort of cocoon therapy where if you had a concussion, and I still get patients that tell me this, they lock themselves up in the room, I can just see them like sort of huddled under their bed covers, not doing anything, the lights blocked out, and then that's where they stay. And of course that creates lots of nervousness and anxiety, and you're not really getting your treatment that you should get. But now we're really kind of encouraging people to get out and move a little bit more. So talk about that exercise intolerance and some of the physical therapy that you do to help get people more active, which before they would have shied away from.
Oh, yeah. Well, and I think in general, that's kind of like, that's a lot of times my education to, folks that have had a concussion is, like everyone's thinking, should I do anything, should I be on my phone, and I think the education typically is, do what you can as long as you can manage those symptoms well, right? And that kind of goes in all the different aspects. And in PT, obviously, we're looking at that exercise component. So what we've noticed, obviously, with athletes too, is someone that's very fit and in shape, if we say, well, don't now play your sport or don't do any kind of exercise, it's bad from a bunch of standpoints, right? From emotional and kind of physiological standpoint, you want to, it's good to get them in, and it also will help the brain, obviously, with the development of that blood flow and kind of help out with concussion. But we typically will push them as long as we're not pushing into those symptoms. So we'll do a test on the treadmill and kind of see maybe when those symptoms come on with certain level of activity, and then we'll keep them just below that level and try to work them through exercise, and that way they maintain some aerobic and exercise capabilities, and then also we mind those concussion symptoms without making it worse.
And that's what athletes ask, or even patients in general, is what exercises am I able to do that won't cause permanent damage. I think there's a fear of that. And so, coming to someone like yourself, I've been really pleased to refer patients there because then they can do this testing, and you can advise them like, hey, you're able to work out, ride your exercise bike, or do jogging at a certain heart rate. And, people don't really know what they should be doing in terms of specific exercises. So that's some good guidance, I think. Yeah.
I agree. Well, what other treatments I know? So we do stuff kind of therapeutically in rehab. We'll push into, we kind of treat the neck, and we treat some of that dizziness with some eye exercises. What other kind of stuff do you do, and what do the physicians do to manage concussion?
Yeah, it's a really good question. I think, again, I want the audience to know that there is treatment for concussions. A lot of people just think you have to sit around and wait for the symptoms to resolve on their own, and there are things you can do to expedite the process, and one of which is getting appropriate cognitive rest, easing back into work, so a lot of management, easing back into work and school, getting specific academic modifications and support at school is key. There are some medications that we may implement, a week or two after if the symptoms aren't responding, with just some behavioral types of things. Some of the medications that our folks utilize are kind of more preventative headache medications that also help the headache, maybe it helps control the headache better, but also maybe preventing or the headache from occurring, but also helping with sleep. being able to sleep better. Some other medications help with like attention, concentration, cognitive efficiency. So our primary care sports medicine physicians are actively involved in that therapeutic process, and that's really helpful. And then, of course, sometimes folks do need some support services, some counseling, things like that. And we've got some great mental health professionals, sports psychology consultants that are at our disposal to refer athletes to help them transition back into play.
That's good. Yeah, that's a lot of stuff. And I think, yeah, the key with a lot of this treatment really comes down to seeing a specialist. And I know that's something that you and I both really believe in with concussions. And I think it's important that as, athletes or parents or coaches, whoever you are, other clinicians, whether it's PT or physicians, if you don't necessarily know what you're doing, make sure you refer to a specialist, because, the research has really shown, I think, that it's important to see a specialist early.
Yeah. And we always kind of use the example of you wouldn't necessarily go to a cardiologist to treat your orthopedic condition and vice versa. So I think the same applies here. Concussion specialists generally have a lot more training with respect to brain behavior relationships, the rehabilitation component, and then also like addressing really the holistic aspect of things, whether it be return to work, school, the objective testing, the functional testing. So yeah, I can't reiterate that enough as well.
Yeah. That's great. Yeah. And are there any kind of, so I'm just going to talk about these longer effects of concussion. Are there any long-term effects of concussion? I mean, is that something you see in your practice?
Yeah, certainly that question comes up a lot. And it's really came up a lot in the past couple of years when it comes to letting kids play contact sports, particularly football, because there is this sort of fear surrounding football in general that it might really lead to chronic traumatic encephalopathy. CTE, big mouthful there. So not every concussion results in that syndrome. Certainly we talked earlier about that repetitive head impacts may result in that syndrome. There's still a lot unknown about it. At this point, though, we really want to just reiterate the proper management to help mitigate any kind of long-term consequences, and some of those may be developing some cognitive issues earlier than what would be expected in our lifespan, maybe having chronic headaches or chronic dizziness or other vestibular issues. Those could be some long-term consequences, but more often than not, with proper management, acute removal from play or activity, getting assessed and getting on the right treatment plan, I believe, and I think you would agree, would really kind of reduce those chances of long-term effects.
Yeah, I feel like the long-term effects that I see typically are, it's either somebody that was, not treated at all, and they just didn't push back into things. They let their brain stay in that kind of depressed state, right? Never got back into exercise or back into activities well. Or you see somebody that just didn't pay attention to the fact they had a concussion. They just keep pushing. So it's like either they do too much or they do too little, right? But they hadn't had someone help guide them and stay in that middle ground that helps push the brain appropriately. So
absolutely. Another question I get a lot too from parents is how many concussions are too many? There is no exact number that we can put on that. I think we've both been exposed to athletes or individuals that have had maybe one concussion, or some of these hockey players and football players have been playing since they're little, and their mid-career have had maybe 10 or 11. And while there's no merit badge here for concussions, or shouldn't be, certainly when it becomes to the criteria that we look for when advising families about maybe we should kind of think about what we're doing a little bit more effectively. Some of those things are, what is the spacing between concussions? Are they happening more closely together? Is it taking less biomechanical force to make the person concussed? Are we then having to rely on medications or other significant treatments to get them better? I think those are the things that a good concussion specialist would take into account, and really talking to the family about, what are your expectations and your goals? I mean, if you're not going to continue to play the professional level, which we all know is quite difficult to do, maybe you need to rethink your priorities for sports. Although, again, I love returning people back to their sport. That's my favorite part about my job. But of course, they've only have one brain, and we want to make sure we keep that for their lifespan.
Yeah. Speaking of brains, how do you feel about your own kids and about kids going into sports? You always hear about parents saying, "Oh, I'm not going to let my kids play those contact sports because I don't want the concussion." How do you feel about that?
You were going to ask the $1 million question, huh? I think it's a thing for every family. It's their own individual decision. For me, I'm blessed to be surrounded by a group of professionals, especially in orthopedic surgery. I have lots of great orthopedic doctors, not just for brain injuries, but for orthopedic issues as well. And so just really, even with my child, really talking about concussion and identifying, the things they should and shouldn't do to help prevent any kind of injury. Can't prevent all of them, but making safe play, good proper equipment, and so forth. I think, again, that if you have all those resources, you're knowledgeable, you properly handle things, I think kids can do well in contact sports.
Yeah. Yeah, I agree. Yeah, I think I'd be happy with kids. I think that the key is just making sure as a parent that you kind of know a little bit of what to look for, and I think for those of you that are coaches or athletic trainers, making sure that you for sure know what to look for so that you can spot these things, because like you said, these kids only have one brain, and we want to make sure we keep it nice and healthy. But yeah, proper management's the key. It's all really does quite well. I mean, you've probably seen who knows how many concussions. I know I've seen a lot as well, and I think the vast majority of them all get better, and it's just just those few, there's some that don't. But in general, it's a very, very treatable condition as long as it's managed well from the get-go. So that's good to hear. It's good to hear.
So I think we've covered a lot of things tonight. Hopefully just kind of brought you some sense here of some different things or aspects. There's plenty of topics related to concussion management. We give talks a lot of times on different aspects, whether it be psychological effects of concussion, gender differences, long-term effects, how to prevent concussion. I mean, there's the list can go on, but I really think the big takeaways here are, we have programs in place that we can manage this. Obviously athletic trainers and coaches are the forefront here of this and identifying that in their athletes. We're happy to partner with you, and we do partner with people all over the city, really fostering a good sense of well-being in the athlete after they're returning back from concussion. And really just, for me, again, the best thing I think every Friday night is getting the call that the athlete did really well, that we returned back to play, or whether it be volleyball, football, whatever. So, and treatment, there is treatment for concussions. So do you have any other takeaways yourself?
Essentially that's it. I think the biggest thing, just to make sure that you get them in to see, a qualified team. Doesn't matter who it is. Obviously, we think our team's really good, but
a little biased, yeah.
Get them in with a qualified team, because if you don't see someone that knows how to manage this, you end up usually having. And some of those are the long-term effects, folks that we see. So we don't want you to be that person if you're having issues. Get into a specialist right away. So.
Yeah. So keep your brain safe, and thanks for tuning in. And please, again, look back at our social media posts for more information about concussion, or reach out to us. We have lots of numbers all published everywhere throughout our social media posts of how to get into our clinics and see our specialists. So have a great night.
Yeah.